It's probably fair to say that glucosamine and chondroitin are the most popular supplements when it comes to osteoarthritis and joint health. But when you look at UK guidelines for the treatment of osteoarthritis, they specifically say we should not be recommending people to take glucosamine or chondroitin. So in this video, we're going to discuss some of the evidence as to why that's the case, and also an approach that you might want to take if you are keen on taking glucosamine and chondroitin towards the end of the video. And we're going to start right now. When you type glucosamine or chondroitin into Google, you will find endless adverts from manufacturers and pharmaceutical companies with claims varying from improving cartilage health to fixing or curing your osteoarthritis. Now, for me, anything that suggests it can fix or cure your arthritis, particularly if it's passive, is always a massive red flag. But before we get into the evidence, let's just have a quick look at what these supplements are supposed to do for our joint health. So glucosamine is a naturally occurring amino acid or protein that we already have within our systems, and it's supposed to help with building cartilage. Now, it can naturally be found in things like shellfish and bone marrow and fungi as well. And in supplement form, it can be taken as glucosamine hydrochloride, glucosamine sulfate, or, as we've already said, in conjunction with chondroitin too. If we take a look at some of the evidence for these supplements, a Cochrane review was completed for the utilisation of glucosamine for the treatment of osteoarthritis. And the first thing they pointed out was that actually there's very little in the way of high quality evidence. Of the high quality evidence that is available, glucosamine tends not to outperform fake supplements, so placebo supplements. Both groups tend to see a bit of improvement in their symptoms, but not enough to be statistically significant. When the low quality evidence is also chucked in there, then glucosamine does tend to slightly outperform placebo. Now, there are a few things that would constitute low quality evidence. Now, one thing would just be it's very old and outdated. Second would be having a small sample size, using animal studies and then trying to transfer that across and make assumptions that we can apply the same findings to humans. And we also need to appreciate, and this is a really big one, is that in order to complete big studies, we need money. And who has the most money? A lot of these pharmaceutical and manufacturing companies. So there's often a very strong risk of bias and a conflict of interest. And it's often these studies that are advertised when these supplements are sold online. Now, a Cochrane review specifically for chondroitin had very similar concerns regarding the quality of evidence. However, their summary was that taking chondroitin for 6 months versus a placebo pill did come out slightly better in terms of outcomes. So on a 0 to a 100 pain score, 100 being the worst pain imaginable and 0 being no pain at all, after 6 months, the chondroitin group came out 10 points less. So they rated their pain 18 out of 100, and the placebo group rated their pain 28 out of 100. They went on to mention that in the chondroitin group, 53 out of 100 people saw an improvement in their pain, whereas only 47 out of 100 saw an improvement in their pain with the placebo group. They also looked at another outcome, which looked at pain, function, and quality of life, and this was a 0 to 24 point scale. 24 being not very good, 0 being very good. And they saw a 2 points difference in favour of chondroitin. When comparing x-rays and radiographs, it was mentioned very similarly that chondroitin very slightly outperformed the placebo group. Lastly, it was mentioned that in both groups, it was very difficult to be conclusive about whether chondroitin outperformed placebo past the point of 6 months. So where does that leave us in terms of glucosamine and chondroitin for osteoarthritis? Well, as I said at the beginning, the NICE guidelines, and NICE are a huge organisation, the National Institute of Care Excellence, who go through all of the research for all of the conditions that you could possibly think of. So osteoarthritis, but also diabetes, heart disease, stroke, cancer. They go through all of the research, and on an annual or biannual basis, they update their guidelines based on the current evidence. So it has to be noted that they've specifically taken out glucosamine and chondroitin from their guidelines because there isn't enough strong evidence to support its use. The other thing that we can take from the discussion today is that placebo is exceptionally powerful. So what we think, what we believe, and our biases and expectations have a huge role to play in our symptoms and our overall condition. So that's important to bear in mind as well. And I've seen it anecdotally as well. People that have been taking glucosamine and chondroitin for many, many years do think it improves their symptoms. And if this is you, I certainly wouldn't recommend stopping. Ultimately, if it's helping your symptoms, it's a good thing. But if you are somebody who is debating whether you should or shouldn't take it, then obviously it's up to you. But what I would suggest is taking a common sense approach. So firstly, introduce it into your routine in isolation of anything else. So don't do it at the same time as starting the gym or starting exercise, because we know that could help. Don't start it in conjunction with turmeric, for example. Start it in isolation so you can be conclusive that that's the thing that's helped or hasn't. Then take it for an adequate period of time, so typically around 2 to 3 months. At that stage, you should have an idea about whether it's improving your symptoms or not. If it is, then you need to weigh up how much it's improved versus how expensive it is, because it can be quite expensive. And if it hasn't improved your symptoms at all, then don't feel the pressure to keep taking it. Just stop taking it and spend your money on something slightly more helpful. If you are watching this video because you do have osteoarthritis, then this is just a quick note to say I have recently put a completely free osteoarthritis ebook together for you, going through how you can manage your symptoms better at home without the need for injections and surgery. So if that does sound of interest, you can find a link to the ebook in the description below the video. I'd love to hear your experience of glucosamine and chondroitin. So let me know whether it's improved your osteoarthritis in the comment section below the video. If you have found today's video helpful, please do like it to show your appreciation. And if you haven't already, subscribe so you get more osteoarthritis related help. And also, if you found it helpful, it means more people are likely to see the video. And whilst you're doing that, I'll see you in the next one.